So the first section in this last unit on sports nutrition is alcohol and nutrition. Not that alcohol and sports go together, but I decided that I needed to include alcohol in an introduction to nutrition class. So first of all, what is alcohol? Well, the alcohol that we consume is actually ethanol. If you've had chemistry, the OL, all, is the suffix that means it is an alcohol. And alcohol, from a chemical standpoint, just means a hydroxyl group, which is an oxygen-hydrogen group. So that's what makes an alcohol and alcohol. Ethanol happens to be the alcohol that we consume. So it's a 2-carbon chain with the hydroxyl or alcohol group on one end. This is one of my favorite molecules to draw because it's really easy to remember. So, ethanol is actually a product made when microorganisms ferment some type of carbohydrate. So the microorganism consumes the carbohydrate and a byproduct is alcohol or ethanol. 90% of the alcohol that you consume is metabolized by the liver, and the rest, it leaves the body unchanged as ethanol, excreted as ethanol in the kidneys or via the lungs as a vapor. When less than a quarter of your calorie intake is from alcohol, the alcohol is completely usable as energy. You don't waste any of the calories. ETOH is an abbreviation for ethanol, by the way. So what the body does with ethanol, the liver metabolizes or processes alcohol. The ethanol or alcohol is converted to a molecule called acetaldehyde by the enzyme alcohol dehydrogenase. And then the acetaldehyde is converted to acetate by the enzyme acetaldehyde dehydrogenase. Now, what's really interesting is people's level of acetaldehyde dehydrogenase vary. If people don't make a lot of it, they don't handle alcohol as well, and they tend to get flushed and an increased heart rate when they consume alcohol. As you know, if you consume a lot of alcohol on a regular basis, the enzymes tend to upregulate, so you use alcohol more efficiently. That is, it takes a larger amount to get the inebriation effects of alcohol. And you see this happen in alcoholics. So if your consumption of alcohol is more than 25% of your calories, which is a lot of alcohol, there's another metabolic pathway that is resorted to deal with the alcohol. That pathway actually wastes some energy, which is why some alcoholics drink a lot of calories but don't gain weight. The energy value of alcohol, it has about 7 calories per gram compared to carbs and protein that have 4 calories per gram and fat that has 9 calories per gram. So it can be a significant source of calories. I put a website or a link to a website that has the calorie content of different alcoholic beverages. Of course, if the beverage, has added sugar, that's going to increase the caloric value. And then if it has added fat, in the case of pina coladas, there's actually quite a few calories, a lot more calories in those types. So about that beer belly, some of the alcohol that's consumed is converted to fat. Some can be used for energy, but if it's, if the calories are in excess, then it can be converted to fat actually pretty easily. The acetate that's made in the typical metabolic pathway can be used to go into, a metabolic cycle that produces ATP. But some of the alcohol can be converted to fat if calories are in excess. Let's see. The acetate can replace fat as a source of fuel. So, if you're into the macro thing and, trying to preferentially use fat for fuel on a low-carb diet, alcohol can hinder that process because the acetate will be burned, before the fat as fuel. So as far as the dietary guideline, the guideline is if you drink alcohol, do so in moderation. Now, a major health organization came out with a guideline is there is no safe amount of alcohol consumption. So keep that in mind when you interpret moderation. It's 2 drinks for men, 1 drink a day for women. And you have to consider the serving size, which is about 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard alcohol. Now, I usually get asked the question in class, can I save up all of my drinks for one day? No, it doesn't work like that. That would be massive binge drinking. So as a general guideline, I put a link on this slide, and again, you can access the PowerPoint slides on Blackboard. There is a website that can convert the number of drinks you've had using your body weight and gender and kind of give you an estimate of what your blood alcohol would be. But in general, 2 drinks within an hour can result in some degree of impairment. So there are some people who should entirely avoid alcohol, kids and adolescents, people who can't control their intake to moderation, women who think they are pregnant or are pregnant, people who plan to drive, operate machinery, do other activities that require coordination or skill or attention. And those people take in over-the-counter or prescription meds that interact with alcohol. And there are a lot of those. Lipitor or the statin medications, are ones that should not be consumed with alcohol. And when you're taking other pain, other medications that depress the respiratory centers, which includes pain medications, there can be an additive effect, and some people have died when they've combined alcohol with depressant medications like anti-anxiety medications like the benzodiazepines, tranquilizers, and the oxy. So binge drinking is defined as at least 4 drinks in a row for women, 5 for men. And is associated with, some health problems. So the health implications, and in fact, actually, when I was in college, one of my, someone who lived in my dorm actually had to go to the hospital after binge drinking. She binge drank on an empty stomach and developed gastritis, which we talked about in the physiological overview section, where her stomach lining became inflamed and started bleeding, and she was in a lot of pain. So there are some potential benefits of alcohol, and every time there is a study, no matter how well or poor the study is, it makes the news, it seems like. But regular consumption of red wine in moderate amounts, in particular, may reduce cardiovascular risk. And that is because alcohol can reduce or increase the good cholesterol, the HDL cholesterol. And the grapes that are used to make red wine have some really potent antioxidants, catechins, quercetin, and resveratrol. Resveratrol has received a lot of attention, grapes that we eat don't have as much of the resveratrol because they're grown in a different climate. So there's some antioxidant properties which reduces the oxidation of the bad or LDL cholesterol. And if you remember, oxidized LDLs are more atherogenic or increase the risk of atherosclerosis particularly. In the short term, alcohol can cause vasodilation, dilation of the blood vessels. That's why some people get flushed when they drink alcohol, which would reduce blood pressure. But overall, alcohol has an effect of increasing blood pressure. The vasodilation can result in what I call the Santa Claus appearance. You know how Santa Claus had the red rosy cheeks and red nose? I'm assuming that for Santa Claus that was due to exposure to cold, but this dilation of the blood vessels with excessive drinking regularly can result in blood vessels breaking on the face and result in that permanent redness on the face. Alcohol does increase triglycerides, so that's something to be aware of. If you have high triglycerides, alcohol should be avoided. And even a moderate intake can increase breast cancer risk in women. Alcohol is also associated with GI cancers, cancers of the throat, esophagus, and stomach, as well as the rest of the GI tract, because it is an irritant that over time can increase the risk of cancer. One interesting study I read indicates that increasing folate intake may help reduce the risk, but still overall I would recommend to drink, if you drink, only in moderation so that you don't have that increased risk of cancer. So the health risks of alcohol: increased risks of breast cancer, liver disease, hypertension or high blood pressure, pancreatitis. I see this a lot in the hospital. That's inflammation of the pancreas that's incredibly painful, and repeated bouts of pancreatitis can result in death of pancreatic tissue, which could lead to a type 1 diabetes because the pancreas makes insulin, difficulty with digestion because the pancreas makes digestive enzymes as well. So a lot of our patients that have pancreatitis at the hospital have it related to excessive alcohol consumption. GI malignancy is cancer of the GI tract, increased risk of stroke. Cardiomyopathy is basically degradation of the heart muscle or disease of the heart muscle. Increased risk of accidents, of course, and embarrassing yourself. So a lot of people with alcoholism develop malnutrition, and it's not just because of poor eating habits and general overall lack of self-care. Alcohol in moderate amounts can increase your appetite or decrease your inhibitions around food, leading to overeating, but a large amount of alcohol every day can actually cause a reduction of appetite or a loss of interest in food, or in some cases you spend your food on alcohol or you spend your money on alcohol rather than food. The irritation of the digestive tract can decrease the absorption of vitamins and minerals, and then the alcohol can cause the gastritis that I talked about earlier and cause damage to the digestive tract. And if it damages the liver metabolizes a lot of nutrients. There's increased excretion of minerals and water-soluble nutrients, including magnesium, folate, B vitamins. Those deficiencies are common, and so for patients with alcoholism, they're typically on supplements. So some research conclusions about alcohol is that it's not just inadequate intake that causes a malnutrition with alcohol abuse, and it's not just intoxication. Alcoholism leads to metabolic disturbances and damage to the digestive tract that can lead to malnutrition even if the diet's adequate. So the effect of alcohol on organs, the liver is the one that comes to mind. The acetaldehyde that alcohol is converted to in the liver damages liver tissue. Okay, when the liver becomes damaged, it starts, it's difficult to export fat. And remember that acetate that's formed from the metabolism of alcohol is converted to fat, can be converted to fat. So fatty liver is one of the first things that happens to the liver with alcohol abuse. This is a picture of a fatty liver. I don't have a normal liver beside it, but if I had one, you would see that it's lighter in color because of the fat, and it's much larger than a healthy liver. And then this is an up-close picture where you can actually kind of see the fat infiltration in the liver tissue. Now, if the alcoholism occurs long-term, scar tissue builds up. And you can see the bumpy appearance of this liver, and it actually starts to shrink because scar tissue contracts. So when the scar tissue starts building up, there's more damage. The liver can't, the normal functioning of the liver can't proceed, and there's a lot of metabolic disturbance in that case. Remember that the liver takes the amino group from excess amino acids and converts it to urea. And if the liver can't do that, ammonia builds up, and ammonia is actually very toxic. So with cirrhosis of the liver, which is a liver that's been scarred up, can't make bile as well, so you have problems digesting fat. Can't make proteins as well, so you get a metabolic protein deficiency. It looks a lot like kwashiorkor. You can't detoxify toxins, so they build up in the blood. You can't make urea, so nitrogen waste builds up in the blood, and so does ammonia. And then you can't metabolize glycogen or lipoproteins, so you get hypoglycemia, and you can't form the lipoproteins for exporting fat from the liver. Here's a picture of someone with cirrhosis of the liver who has ascites. You note how malnourished he is by the appearance of the wasted fat and muscle in his arm, but his belly is huge because of the buildup of fluid, the ascites. The buildup of fluid, because blood can't flow freely through a liver with cirrhosis. The portal vein, and pressure builds up in the portal vein, and water spills out of the portal vein. But with the low proteins, because the liver can't make blood proteins, the water is not attracted back into the blood vessels. So there's a lot of fluid that builds up in the belly. The GI tract is affected by alcohol consumption, like I talked about before. There can be inflammation of the stomach lining. Alcohol can increase the production of acid, so a lot of people who consume a lot of alcohol have GERD actually because of it, or reflux because of it, and then it can exacerbate ulcers as well. Again, I talked about the damage to the GI tract, reducing absorption, and a really interesting phenomenon occurs called esophageal varices. This is because, again, the portal vein, a lot of pressure builds up in the portal vein, which, remember, is the vessel that takes nutrients from the digestive tract to the liver, and the vasculature starts to back up. A lot of pressure builds up in the vessels in the digestive tract, and so you kind of get these varicose veins almost in the esophagus, which can rupture. So if you ever see a medical show and somebody an alcoholic starts, blood starts coming out of their mouth, that's because of burst esophageal varices. This is a picture of a gastric ulcer due to excessive alcohol consumption. And you can see the veins here that are distended. Those are the esophageal varices that can burst. They're also on the inside of the esophagus. The brain, alcohol can be absorbed through the stomach, unlike most other substances we consume, so it can reach the brain within a minute on an empty stomach. And over time, alcohol can damage nerve cells in the brain and result in dementia. If you know the anatomy of a nerve cell, it has these branch-like projections called dendrites, and the dendrites become broken up so that nerve conduction can't occur like it should. That can result in dementia over time. Alcohol also, and this is not just for alcoholics, but alcohol affects a hormone that controls fluid balance, and so alcohol consumption, especially in excess, results in excessive urination, which is why you lose a lot of one of the reasons you lose a lot of nutrients in the urine, because of the excessive urination, and it can cause dehydration. Okay, that weird-looking thing in the center, that's my drawing of a brain. Okay, so to better handle alcohol, don't drink alcohol on an empty stomach. Limit to 1 drink per hour. and only time will have a sobering effect. You see on, movies and TV, people giving people who are drunk coffee, to make them more alert. No, that won't sober them up. Only time will do that. The body has to have time to metabolize the alcohol. So I have some information here on assessment of alcohol use to determine if it may be risky or actual alcohol abuse. So you can take a look at that slide. And these are some of the things that can be an indicator of alcohol dependency. If you have a tolerance, like I said, if you drink a lot on a regular basis, those enzymes that metabolize alcohol will upregulate, so you won't get as inebriated on the same amount of alcohol. Withdrawal, when you stop drinking, that's one of the reasons with this that liquor stores are actually open during the COVID crisis, because people are like, why is that essential? Well, alcohol withdrawal can be lethal. You can go into seizures. And so we don't want the ERs flooded with people going through alcohol withdrawal right now. If you spend a lot of time using alcohol or recovering from its effects, call into work a lot because of hangovers, if you're giving up, social activities, drinking more or longer than intended, and if you can't stop, that's an indication of addiction. And, if you continue drinking despite the fact that it's disrupting your life. Here's another indicator of, determining if alcohol consumption is unhealthy. And again, it's on the slide set that's in Blackboard. And then this is this is a pretty good screening tool for alcohol abuse. Okay, so that's the end of that section. You can see my shadow now. So I'll actually start talking about eating disorders next.